If your parent is on an Alzheimer's medication, the cholinesterase inhibitors such as Aricept, Exelon, or Rizodine, you know it modestly helps with memory and helps with daily function a little bit, but it's not life-changing. On average, they help maintain function for about 6 months. But there's a problem with these drugs. These drugs destroy your parent's stomach, and that's why they're not used more widely. Constant nausea, vomiting, diarrhea, no appetite, maybe they're not eating, and maybe they're losing weight. And you're watching someone you love deteriorate, not from the disease, but from the medication, a medication that's supposed to help. And for 20 years, that's all we had. That was the compromise. Better memory or a stomach not in pain. You couldn't have both. Until now, a new Alzheimer's drug came out 2 years ago. You might be wondering why I'm telling you about a drug that's been out on the market for over a year. Well, last month, we finally got real-world data showing that it might actually solve the problem with one of these drugs. I'm David, lead pharmacist with MyRxPro. I'm going to explain what makes Zunveyl different, why it matters for caregivers, and exactly what steps you need to take to get your insurance to approve it. Let me explain why the older Alzheimer's drugs were so hard on the stomach. The standard drugs, donepezil, also known as Aricept, galantamine, also known as Rizodine, and rivastigmine, also known as Exelon, they all work by boosting a brain chemical called acetylcholine. Acetylcholine is necessary for memory. In Alzheimer's disease, acetylcholine levels drop. We've talked about this in past videos on this channel. It's one of the hallmarks of the disease. These medications stop the breakdown of acetylcholine, so there's more available for memory or thinking. That's the good part. Here's the problem. These medications protect acetylcholine everywhere else in the body, not just in the brain. So when your parent swallows the pill, it also floods their stomach with acetylcholine. And in the stomach, acetylcholine causes severe nausea, vomiting, and diarrhea. Doctors and researchers wanted to increase the dose to see if it could result in better memory, but people physically couldn't tolerate the dose. This drug literally made people sick to their stomachs. The side effects were too brutal, so patients hit a wall. They would get too sick before it could boost their memory. Many chose to give up, even on the promise of better memory. Your parents are stuck between choosing memory or eating, between cognitive help or a digestive system that's not fighting them back. Zunveyl was designed to break that compromise. Now, first thing you need to know, Zunveyl is Benzgalantamine, which sounds a lot like galantamine, and the molecules look similar. It's what we call a prodrug. Let me explain what a prodrug is, because this is the major difference of why it works. A prodrug is a medication that's inactive when you swallow it. It doesn't become active until your body metabolizes it into the active form. Here's how Zunveyl works. When your parent swallows Zunveyl, they're swallowing Benzgalantamine, which is an inactive molecule. It doesn't do anything. It doesn't affect the stomach at all. In the small intestines, it is rapidly absorbed. But in the liver, enzymes break down Benzgalantamine and convert it to galantamine, the active medication. By the time it becomes galantamine, it's already past the stomach, so the stomach avoids getting flooded with the active form of the drug, so it doesn't cause nausea, vomiting, and diarrhea. Other cholinesterase inhibitors are active in the stomach. Zunveyl is different. The chemical itself doesn't become galantamine until it's been metabolized in the liver. The chemical itself doesn't become galantamine until it's been metabolized in the liver. Less stomach exposure, less nausea, less vomiting, and less diarrhea. Zunveyl was designed to provide the cognitive benefit without the gut destruction. However, this was only theoretical until last month. A major study called Beacon was published showing real-world data. They looked at patients who had failed one of the cholinesterase inhibitors because of stomach issues in the past. 89% of those patients could successfully tolerate Zunveyl. That's huge. For caregivers, that means your parent might finally be able to take an Alzheimer's medication without the side effects ruining their quality of life. Now, I always want to give you the reality check. Zunveyl may have solved the stomach problems, but it doesn't cure Alzheimer's. It's designed for mild to moderate dementia. It helps with memory, it helps with daily function, but it doesn't stop the disease from getting worse over time. You might have seen commercials about the new IV medications like Leqembi or Kisunla. They claim to slow the disease progression. I actually covered those in a previous video. Link is in the description. Those heavy-duty intravenous medications slow Alzheimer's progression by approximately 25%, but they require going to a clinic frequently for IV infusions and extensive monitoring, including costly MRIs. They're much more heavy-duty, and they carry risks of brain swelling and bleeding. Zunveyl is not that. This is a once-daily pill. Zunveyl is relatively safe, no extra clinic visits, no extensive monitoring. However, Zunveyl is only symptom management. They are not disease modifying. At least, we don't think so. Now that the stomach toxicity is solved, researchers are asking a new question. Can we finally push the dose higher to get better cognitive results? There's finally a brand new trial that started enrolling patients this month to answer that exact question. So Zunveyl might just be the beginning. We could see higher doses with greater benefits than what we could see with other cholinesterase inhibitors in the past. If you and your doctor decide Zunveyl is worth trying, your real battle isn't the science, it's insurance. Because Zunveyl is new, it's expensive. Insurance companies are going to push back. Here's what's going to happen. Your doctor writes a prescription, it goes to the pharmacy, insurance denies it and says, use the cheaper, older generic first. This is called step therapy. It is designed to save insurance money, not to protect your parent. But you can fight this. Your doctor needs to submit what's called a prior authorization. And in that authorization, they need to document exactly why the older medication didn't work. They need to write, the patient experienced severe dose-limiting gastrointestinal side effects on Benzgalantamine or rivastigmine. Weight loss, nausea, vomiting, inability to tolerate therapeutic doses. This is why we're switching to Zunveyl. Prior authorizations typically take 3 to 7 days. Sometimes faster, but it really depends on your insurance company. If insurance denies it, and they are likely to deny it on the first try, your doctor can appeal. The appeal usually wins when the clinical documentation is solid. The problem is, you will probably have to play the stance for a few weeks, but be persistent. That's usually how you beat insurance. Now, what if your doctor won't do the paperwork? Some doctors don't like fighting insurance. If that's the case, you can ask the pharmacy to contact the doctor's office and request a prior authorization on your behalf. Pharmacies do this all the time. Or 2, ask the doctor to refer you to a neurologist who specializes in dementia medications. Specialists are more familiar with these appeals and are more willing to fight. Now, let me address 2 scenarios. Scenario 1, your parent is already on an older dementia medication and experience severe stomach issues. If your parent is currently losing weight or constantly nauseous on Aricept, Exelon, or Rizodine, do not accept that as the new normal. Call the neurology clinic this week, report the symptoms directly. Request your doctor submit a prior authorization for Zunveyl. Document the side effects, weight loss, how many pounds, nausea, how often, vomiting, how many times per week. This is the documentation that wins the insurance appeal. Scenario 2, your parent was just diagnosed and hasn't started any medications yet. If this is the case, insurance will almost certainly require you to try the generic cholinesterase inhibitor first, probably donepezil. If this happens, ask your doctor to start at the lowest dose and increase very slowly. Take it with food can help. If your parent still can't tolerate it after 4 to 6 weeks, then you have the documentation to request Zunveyl. The key is report the side effects clearly and consistently. That's what builds the case for insurance approval. If you need help navigating these conversations with your doctor, or if you're getting pushback from your doctor or insurance, book a medication review with me at MyRxPro.com. We'll review your parent's situation, help prepare the documentation, and give you the exact talking points to advocate effectively. Link is in the description. We finally have an Alzheimer's medication that might be worth considering. For 20 years, that wasn't possible. Now it is. Don't let insurance bureaucracy or a doctor who doesn't want to do the paperwork stand between your parent and better quality of life. Make the call, document the side effects, advocate hard. If this video helps you, drop a comment to let me know. And if you know a caregiver dealing with the same issue, share this video with them. I'm David, lead pharmacist at MyRxPro. Thanks for watching.